Welcome to NY Cosmetic Surgery podcast, where we dive into the latest innovations, industry insights, and very inspiring stories. I'm Dr. D to inform, inspire, and ignite your passion. Today, I'm thrilled to welcome to our podcast
Laura, your physician assistant.
Yes, Laura Moore. We have been working together for quite a bit.
Almost 3 years.
Exactly. So could you share with our listeners what ignited you? What prompted you to think and get into physician assistant school?
Sure. So I started out, I was always an athlete. So I worked with a lot of different medical professionals. I had a lot of injuries. So I met a lot of nurse practitioners, physician assistants, surgeons, a lot of different kinds of doctors. And as I worked with these different medical professionals, I was kind of figuring out where I wanted to go in the clinical side of medicine. At first, I thought I wanted to do physical therapy. I have a lot of injuries, like I said, and I worked with some amazing physical therapists who really got me through a lot of injuries and worked with me very closely. And then I realized that it wasn't the holistic side of medicine that I wanted. I wanted more than sports medicine. So I ended up having surgery on my wrist. So I worked with a plastic surgeon for reconstruction, and the surgical PA walks me through the entire process. It was long, it was complicated. It was multiple surgeries, and this woman really guided me through the whole process. She was there with me every single day, and I really saw myself through her. I thought, wow, I could do that. And I knew I wanted to work closely with patients, both in the OR and in the practice and just through follow-ups. So that's when I really started looking at PA school and how do I get there. And I realized it was a lot of the same courses that I had already been taking, like the prerequisites for medicine. So I just really zoned in on physician assistant programs and ended up here.
I know it's not easy to get into PA school, very competitive, especially it became very competitive lately. Could you give us a background, your background?
Sure. So that you're absolutely right. And especially when I was applying back in 2018, it was really competitive because there was kind of a shift between family medicine started having more PAs and nurse practitioners involved. And so there was a huge uptick in PA programs. And a lot of people told me, oh, take a few years off, don't apply yet. Get some years under your belt as a medical assistant. And I said, no, I'm going to do this. And so I worked as a medical assistant for a while. I worked in urgent care. I worked at a rehab center as a nursing assistant before that. So I'd had a lot of experience as far as medical hours, which is what you need to apply to PA school. So I had seen more of the rehabilitation. I'd worked with a lot of geriatric populations in senior homes. And then I worked in urgent care, which was a quick turnaround in and out. That's where I learned how to, do phlebotomy and more hands-on things. And I actually worked with a lot of PAs who had gone right to urgent care from school, and they were fabulous. They had a lot of autonomy. They're on their own with a supervising physician, watching over, but really that practice from 9 to 5 is theirs. And they were seeing patients every day. So I got to see, I got to see early on what a PA looks like, more so on their own and working, with that supervising physician, but really the day-to-day was them working with their patients. So I got a lot of my hours in those settings, and that kind of just secured my idea that I wanted to really do this.
But also, I know that you had very rigorous educational background,
Right.
starting from very competitive schools,
Yes.
and you graduate from BU.
Right.
Could you give us a little bit more information
Sure.
on that?
Yeah, so I went to Boston University. They had a School of Health Sciences, which is really what geared me towards that program, Sargent College. And so all of my internships, I mean, you're just surrounded by hospitals. So I worked at Mass General for a while. I worked with an orthopedic surgeon. That's where I first got to see the OR, actually. It was just amazing. I got to have so many different opportunities to work at different medical practices in a city that's, I mean, it's a wonderful city. So I was actually just talking to my advisor the other day from Sargent College because they have such a strong community and they really help you find exactly what you're looking for. So I had a lot of opportunities there, but I knew freshman year I took Bio 101, I took Chem 101, and I knew sciences were where I was going to thrive. So I just kind of dove right into that. You know, anatomy, physiology, all those courses, when they inspire you, you kind of know you're on the right track.
So you have been involved in a lot of sports, and you embarked on very competitive avenue in medicine. So do you consider yourself competitive in nature?
Yes. It's like in my DNA, I think. For so much of my life, sports were everything. So my competitive drive was kind of on the field, you know, in the rink, wherever my sport took me, whatever season it was, that's where like my competitive drive came into play. And then I had a lot of injuries, like I said, and I kind of realized that I need to focus on my career and figure out where that's going to take me. And that's where I started getting competitive with this career path. And I just really dove into my academics and the different courses and internships. But yeah, I definitely feel like, and when you go to school, you know, I'm sure this is how medical school was throughout the whole process. Everyone's competitive. You know, you have to have a little bit of a competitive drive to make it and succeed.
In medicine, I truly believe that it's a huge plus to be competitive.
If you're not, you might get left behind, to be honest with you.
Exactly. Perfectionism is fundamentally important
Right.
in medical field, and competitiveness is a huge plus.
Especially in your field. Like, I think cosmetic surgery, you have to be a perfectionist to really succeed.
Absolutely.
That's what kind of drew me to this field, and watching you as a student, I was like blown away at how detail oriented you were and the art of cosmetic surgery.
Yes, it's a combination of science and art and passion. You have to
Right.
have passion to what you do, because it's not everything is hunky dory.
No.
No, and some days we have very very hectic days, and it's tiring and frustrating. But if you truly love what you do, it doesn't feel like a job.
No. Honestly, coming to work here every day, I don't feel like it's work. I feel like it's every day we're pursuing a different passion, whether you're helping someone get the procedure they've always wanted or you're seeing follow-ups after surgery, getting them through that period. It doesn't feel like work. It never has.
And I find that every day or every week we learn something new all the time. So I keep learning and sharing my experience and knowledge with you.
Right.
And that's what's main driving force in everything you do to become the best.
Right.
I would like our listeners to know how challenging it becomes to actually establish yourself as a PA.
Sure. Undergraduate schooling, it was a lot of high-level sciences, like the same prerequisites that you need to apply to medical school, and you have to maintain a high GPA to be even eligible to apply. You need to have a lot of paid medical hours, so you have to make sure while you're in school, you have the internships, you have the shadowing, but you're also getting paid as a medical provider. So that's where I started working as a medical assistant. I was a nursing assistant. You have to have those hours of like clinical care where you're paid to work because that proves that you have some kind of skill set to, you know, provide medical care. Then once you're eligible to apply and you have all the hours, you have the right GPA, then you go for interviews, same as medical school. And what they're really looking for in those interviews is like your personality more so than anything. You're eligible to apply at this point. You pass all the check marks to get there. Now you have to hold a conversation. Now you have to show that you have some kind of bedside manner. Once you get past the interview, then you're finally into PA school. Now that's where it gets rigorous. So it's basically 2.5 years of medical school. You have to get family medicine curriculum done in 2.5 years. So the first year you take like 12 classes a semester. It's tough. It's the first year is all in the classroom. If you can make it past that first year, then the second year is half classroom, half clinical. You're going all day for clinical rotations. Again, you have to hit all the rotations that are required for family medicine with a few additional. And at the same time, you're going home from those rotations to study, make sure you can still pass all the exams. So they, my school made you pass at like the national average level, which means that every exam they tally where's the national average meet. We had to get above that. So if you couldn't pass the exams and meet the clinical criteria, then you weren't going to make it. And then after that, I had another internship. I went into a plastics internship for 3 months, and again, your skills are tested and your studies aren't tested. And if you can really combine both of them, then you'll pass. You take the exams, and then you can really start your career. Unfortunately, some people can't do the clinical, they can't do the school at the same time. It's too much. It's a lot at once. So I remember I was living in a apartment building, and there was some medical students there as well. And a few times we'd study in the same area, and I'd be like, how's it going? And they'd be like, yeah, it's great. I got some classes, I got it this and that. And I think where I had 12 classes, they had about 6. So it is a lot at once, and you have to be able to do it quickly. It's like an accelerated program, if you will. So it's not for everyone, but for me, it was like exactly what I wanted. I wanted to have those 2.5 years and then go right into working for someone like you. Like, this was literally my dream, and it was the right path for me. I would say it may not be the right path for everyone, because it is very specific.
As a PA, would you be able to switch? For example, you can work for a few years in plastic surgical field.
Yes.
Then you can just think you can decide that in the middle of your journey that you can join orthopedic group. Could you do that?
Yes, that's also a huge benefit to the PA track, is the flexibility. As, say, a nurse practitioner, you specialize, you pick a path, and that's the path you go down. For me, I can jump around. So with you, I do cosmetics. With Dr. Andes, it's cardiothoracic. And then I do some flex hours at the hospital, which is neurosurgery. So you have that room to jump, which is something I've always loved about it. Even some of my peers from my class, they started in urgent care. Some of them went to OBGYN. You can move around and really figure out where you fit, which is beautiful. That's what you were looking for.
It's amazing. So flexibility like that is absolutely amazing.
And that's why the schooling, I think, is rigorous in that time frame, because you do need to have that flexibility. You need to know where you're going to fit, but have the basic skills to be able to hold yourself as a provider in each field, wherever you go.
What is the difference between PAs, physical assistants, and nurse practitioners?
So the difference is in the education. So as a nurse practitioner, you first become a nurse, and then you go to NP school, which it could be accelerated as like an additional year, could be 2 years. It depends. But their education's really in patient care and delivering like patient care based off of the physician or whoever's ordering them to provide a certain amount of care. Whereas I was trained in like a medicine background. So my schooling was in medicine, which means like we're trained more in diagnosing and treating. And again, it's a different path. I was never a nurse. So I went straight from undergraduate school to my master's for physician assistant studies. So it's really in the education more than anything else. Obviously, once you graduate, you have different abilities, and that's also where the paths differ. So a nurse practitioner in New York can open up their own practice. A physician assistant needs a supervising physician. So there are differing paths. A PA, for me, it was a big deal that I can go in the OR and assist surgeons. That was like my favorite part of this career path. Whereas a nurse practitioner, that they don't go into the OR. But where it really differs is the education.
Are those middle-level providers, physician assistants and nurse practitioner, can consider themselves independent providers?
So I don't consider myself an independent provider. I can practice independently under your supervision. So there's an umbrella. I feel like when I practice, especially here at SC Medical Arts, I'm practicing with your methods. You know what I mean? I'm following your guidelines and I'm always under your umbrella. So it's, I'm really executing your technique, your philosophies, your beliefs. If I were a nurse practitioner with my own practice, it could be different. I feel like that's more of like an independent environment. I practice independently, but under your supervision.
So this particular way of practicing independent but under supervision for the physician supervision,
Right.
it's only applicable to PAs, not NPs?
It's in New York, it's more so applicable to PAs, yes.
So nurse practitioners can open practices and perform, for example, inject Botox or fillers, or do a lot of diversity in terms of aesthetic rejuvenation independently.
Yeah.
Okay. So, but comparing to in terms of years, a nurse practitioner, probably it takes 8 years, right? Or more
To become a nurse
to
practitioner.
become a nurse practitioner.
No, so say like BU didn't have a nursing program. So my friends who ended up going into nursing from the School of Health Sciences, they did an additional year to become a nurse and then an additional year to become a nurse practitioner. So if you go to a school where the undergraduate program has nursing, then really all you need is an additional year to become a nurse practitioner, depending on what you're trying to do and if you choose an accelerated program.
It's quite interesting.
Yeah. Versus PA is typically 2.5, if not more. Like the program I was in, they had a night school if you wanted to work throughout the day and then go to PA school at night, and that would have taken 3.5 years. But typically, it's a 2.5 year program for your master's.
Nevertheless, it takes absolutely, it takes a lot of hours.
Yeah.
It takes a lot of years in order to become PA or
Right.
NP. And mid-level providers are fundamentally important
Oh,
for
yeah.
any practice. And it's becoming more and more popular.
Right.
And that's why competitive as a result of
Right.
that.
And if you ask, I mean, most people, when they go for their physical or their annual visit, they're seeing a nurse practitioner or a physician assistant, whether they realize it or not. They're seeing a mid-level provider because that, we've really filled the gap where it has needed to be filled. I'm from Vermont, and there's a lot of, we need doctors in the rural areas. There's just not a lot of providers. And so, PAs have really filled that void for at least family medicine and internal medicine.
Do you think that practicing independently without supervision as a mid-level provider is safe?
Personally, this might be not what everyone thinks that I should say, but I don't think it's safe. I like practicing under you. I think there's a very specific point to be made when you're looking at different medical career paths. Do you need to hold the scalpel, or are you okay with like working with someone very closely? And I feel like I never needed to hold the scalpel. So I want to work with you. This was my dream, to work closely with a surgeon and like follow your exact guidelines, use your techniques, learn from you every day, and execute your philosophies for treatment, especially, in cosmetics. You have such an aesthetic eye in that you've had from experience from, all of your background in medical school. I've had 2.5 years of very condensed training. My training is nothing compared to yours, really. So I need to learn from you, and I need to work with someone who has your experience and your expertise to be able to be an asset to your practice. For me to go on my own, to me right now. It seems crazy. I don't have the experience for that. I don't have the training. I can't cut to learn how everything looks from the inside out. You understand the human body better than anyone. I'm a better provider as your PA, in my opinion.
You're right. I truly believe that training, you have very, as you pointed out very well, that your training is very condensed.
Yeah, it's great for what I am,
Great, right?
but it's condensed and
That-
it's short.
So, what happened if you are as a mid-level practice, and nothing wrong with that, and I truly believe that we have wonderful nurse injectors,
Absolutely.
nurse practitioner injectors, PAs, working not necessarily independently, but in remote supervision
Right.
type of deal, and we know that. But at the same time, when complications happen, that's where safety point is very, very important. That's where lack of training and experience is going to define what is safe, what is not safe. Every time I pick up scalpel or every time I pick up needle, I know what kind of complication can happen. And in my head, I go through all this scenario and I know no matter what happens, I will take care of it.
Right.
Can all of those mid-level providers take care of complications no matter what? Probably not.
Probably not. And the first thing that happens when there is a complication that maybe they haven't seen before is they pick up the phone and they call a physician. And that's what I would do. I would pick up the phone and I would call you because you know more than I do and you have the experience. And I've learned so much from you over the past 3 years, like from when I started till now. I mean, I've seen so much more and I've learned so much from you, but there's still so much I haven't seen. And without the experience, I won't see it.
Exactly. It took me 25 plus years to actually get where I am right now and feel comfortable
Right.
to take care of certain things,
Right.
fix something which could potentially happen to anybody.
Right.
So that's why time is fundamentally important when it comes to how much time you can put into your training.
Right. And how much time you want to put in.
Exactly.
So if I'd still be in school if I were to undergo the path that you took. And for someone who wants that, that's great. You just have to make sure that's what you want. For me, I'm exactly where I want to be. This is the path I chose. This is the future I want. But for someone else, maybe they do want to hold the scalpel, and that's great. But I would say 25 years is a good amount of time to be able to now operate on your own,
Pretty much what you're saying is that time what scares people, what
Yeah.
wear them off from pursuing medical school.
That's one, I think that's one daunting fact is that medical school is a lot of time. It's a lot of money. It's a lot of time. Some people I don't think that fits in their life. Maybe, where their life is at that point. I don't know. But I think that is one of the reasons why PA was such a good option for me. Even I was looking at physical therapy at one point. That was like 5 years. You get your doctorate in physical therapy, but that's a lot of time for that area of expertise. So for me to do 2.5 years to become a PA, that was the perfect combination for me. So
And you can truly expand from this point and on.
right. Oh yeah, I truly feel like I'm learning every day. There's not a day that goes by that I don't learn or pick up something new or see something I've never seen. And I think, what really drew me to you is that you take care of patients, your whole body organic rejuvenation. You're not just cosmetic surgery or aesthetics. You really treat patients as a whole. So, I mean, I feel like I'll learn something every day for a long time.
And we have to. We cannot be just surgeon or just. We have to know as much as possible when it comes to our patients. And no matter what you do, you take calls in neurosurgery and problems are so diversified.
Oh, yeah.
And you cannot call for every single issue to medical doctor.
No.
You have to know the core.
Yes.
And that's what distinguishes good doctor from excellent doctor, good PA from excellent PA or excellent provider.
You have to think critically every day.
Every single day. And you have to challenge yourself every single day. What I made a rule for myself. I must learn one new thing in a day. And that's how I build up my knowledge, build up my skills, and just continue enhancing myself as a cosmetic surgeon in this competitive field.
Absolutely. Because it's evolving every single day, too. It's like, if you don't think like that, you're going to get lost.
In a blink of an eye, you become a dinosaur. I have had discussion with my 16-year-old son. I always hear from him is that, Mommy, I love medicine. Medicine is great. I see how you are and Daddy inspired with this particular training and your career in general. I don't want even think to put 20 years of my life into becoming a surgeon or a doctor. Timing is very scary factor for this generation.
It is.
So
I think it was a little scary for me. Even 2.5 years after school, a lot of my friends went into finance, and they have jobs, they have careers, and they're off to the races right after we graduated. And I was a little scared because I wasn't even accepted into PA school yet. I was in the whole period of applying and making sure I had everything ready. And then once you get an interview, you're all excited, but that's just like step one. And then once you get into school, it's like, oh my gosh, now I got to get through this because I've invested so much time into even applying. So I understand that timing is daunting, but I mean, I have the utmost respect for surgeons. To me, you guys are gods. Because of how much I respect medicine in my own path, I truly think that putting those 20 years into this kind of profession is incredible. And I think it's invaluable. And but you have to have that will to really finish it, because once you're on that path, I mean,
that's it.
Every moment counts, because if you stop, where did that time go from that which you already invested? So you really have to want it. If you don't want it, if you don't want it now, then how are you going to want it after you finish? You know what I mean? But I think even, your son understands the beauty of it. When you've achieved greatness, like, you really have like someone's life in your hands every time you operate. I think it's really invaluable, and that's like, to me, that's the highest respected profession, more so than anything else. I respect a lot of professions. I have friends that are lawyers. I have friends, again, they've put in so much time and effort to school, and I think it's incredible. But there's something about being in the operating room and being able to like reconstruct someone. I just think it's beautiful.
Disassemble something and assemble.
And to have that vision in your head. Even I'm in awe, and we do this every day, but I'm always in awe of how you have a vision and you really change someone's life from the inside out. It's pretty cool.
I was scared too with timing. I just did not want to put on hold my life for 20 plus years. But when you are in it, you don't think about it. You're looking into the light at the end of the tunnel. It's very addicting.
Yeah.
You just in it. You do not think, but at the same time, you're right. As soon as you make decision to start on this particular lengthy and demanding path, you cannot go back.
No.
In our field, in our training, doctors training, we cannot switch. We don't have flexibility. So, sure, you go into medical school, you have to complete 4 years undergraduate degree. Usually it takes approximately from 2 to 3 years between applying to medical school, interview. plus 4 years of medical school. Now we're already in 10, 11 years, right? So then by the end of medical school, you have to decide you're going to embark on surgical path, medical path, or in emergency medicine or anesthesiologist. So you, as soon as you get into that particular residency, you complete it. And all of a sudden you decide that you don't like it. So now you have to, if you decide to switch from surgery to anesthesia, you need to scratch all these 5 or 8 years of training and go back and start from square one. So it means another 5, 6 years of training. So you need to be truly sure, 100% positive that that's exactly what you want. Otherwise, you are losing a lot of time, a lot of money, and a lot of efforts. Actually, this surgical training is super rigorous.
And you could want surgery, and that could be like your dream, and unfortunately there's a chance you could never get it. So you have to have that competitive drive, because like for me, the scariest point was when I was applying to PA school, and I was like, okay, I've invested all this time. I geared all my courses now towards the PA track. So even if I wanted to switch, I have to go back and make sure I have different prerequisites. So, and now I've, invested money into applying. If I don't get into PA school, which could have happened, if I didn't get into PA school, now what? That to me was the scariest part. Once I was in, I was like, all right, I'm going to do everything I can to make this happen. And that's the passion behind it.
Medical school is even more competitive when it comes to certain specialties, right? Surgery, only 5 to 10% of the class will match with surgical residency. 5 to 10%. It means you're competing with the best out of the best.
The best.
To get into medical school, it's already a challenge, huge challenge. You know how competitive it's like super competitive. But now you're competing with those highly intelligent, driven people, and you have only 5% to get where you want to get. So okay, fine, that's one challenge. When you get into surgical residency, it's actually 2 tracks: preliminary track and categorical. So I got accepted into Stony Brook General Surgical Residency, where we had 40 residents or 40 interns, first year surgical residency. Out of 40, it was 5 categorical residents and 35 preliminary. So out of those 40 residents, only 5 would be graduating. So every day you have to work 80 plus hours. Right now it's more regulated and controlled. At that time
it's like 140, right?
But of the book. So you work hard, you perform your best, and every day they look at you, they assess you, they judge you. They are looking to
break you.
And working hard, performing the best is not enough. You have to every January we would take AppSide. AppSide is an exam, and based on AppSide score, they would decide who is going to stay and who is going to be promoted. And I remember that first 3 years was a lot of people a lot of residents were fired or would not be able to be promoted based on AppSide score. So just imagine that people who always compete, who are getting the best score, because in order to get into surgical residency, you must have the highest score on step 1, step 2, and step 3 USMLE, much higher than for other medical students. So those people who got into surgical residency, they are already the smartest people. And on AppSide, those people would get like into fifth or third or 10th percentile from the bottom, not from the top. So they would get 10% on upside score.
Right.
10% from on upside score, where average requirement should be 50% more. That's how difficult upside exam was. So it was a nightmare. I hated January for 5 years. I just hated this month because of surgical residency.
Yeah.
So I understand being competitive, it should be in your blood.
It has to be.
Especially when you embark on medical path. Otherwise, you are not gonna be making.
Because you have to fight every day. There's days when you can't even see straight, and you still have to go home and study.
Absolutely.
Because otherwise, you're just not gonna make it. It's so funny that there's always like a joke when, orientation freshman year of college, and you're going around and everyone's saying what they want to do, and there's that person that's like, I'm gonna be an orthopedic surgeon. Yeah, it's like, and you just like, and then next thing you know, like after first semester, they're no longer pre-med,
Exactly.
and they're in a different school entirely, and that's the whole thing, because it's just like bio and chem 101. Like, wait, after that, they're just done. It's funny because you can want it. That was my thing. Like, you can want it as much as you want, but if you're not good enough to get it, that it doesn't matter.
And how orthopedic surgery is even more competitive than general surgery. It's only 0.5% of class, or 0.1% of acceptance to orthopedic. So this is beyond. So this is beyond competitive.
Right. And I love but that's another thing I love about medicine. Like, it's so many different aspects where you have to be book smart 100%. You have to know how to study. You have to understand it to like apply it to a clinical setting. And then you also are tested like with your clinical skills. Like, are you good with your hands, really? Can you do what you have to do to practice? And if you can't connect all of those dots, then it's not for you.
Absolutely. That's a huge difference between being smart and being intelligent. Being smart is just ability to extract knowledge from the book. But being intelligent is the ability to extract knowledge from the book and apply them into real world. So if you're just smart, you're way behind of being intelligent.
Yeah.
You cannot be intelligent without being smart, of course, but you can be smart without being intelligent.
Right.
So I'll give you examples. In surgical residency, when we started as an interns first year, and I started with amazing guy, absolutely great guy, knowledgeable. He was like an encyclopedia,
Right.
walkie-talkie encyclopedia.
Great memory.
Great memory, superior scores.
Right.
He knew everything from the top of his head. But when it came to applying those knowledge, he was completely lost. Completely lost. He was able to match with very competitive residency, surgical residency, but he was not able to actually proceed. So he dropped out and he went into research. And now he's a very, very good scientist.
Yeah.
Somewhere else.
But maybe just like went for the PhD in the research aspect, not the clinical side. And that's what happens a lot when the courses go from, the basic course to the more clinical side, and you have to actually apply the knowledge to scenarios. That's where a lot of people change their path, actually. Even in PA school, after like the first 2 semesters, some people went to different career paths. They didn't pursue the PA because they couldn't take that knowledge. It was all memory. They could remember it. They could answer the test question, multiple choice. They knew exactly what it was. They had a 4.0 with that. But then once it turned into like apply it to a clinical scenario, it just didn't work.
Exactly. Also, very important, fine skills, dexterity, and your vision, aesthetic eye, or in general, how you look at surgical field, and how can you make something out of whole mess?
Right.
This is completely different skills. So as a surgeon, we have knowledge, we have skills, we know how to apply knowledge into real world. But now when you are in the operating room, you have to do it very fast.
Yeah.
That ability to think on your feet, and you cannot make mistakes. Now, it's another skill, how to separate your emotions, your anxiety, anything whatever going through your head, because by the end of the day, we are human beings.
Right.
We have emotions. Now we have to put everything aside and use your knowledge, skills, everything in few seconds and solve the issue. Laura, what are the major limitations for you as a PA?
I would say, like, I practice under your supervision and I practice with your techniques and your strategies and your philosophy. I don't consider it a limitation. This is like kind of what I've always wanted, but am I going to go in the OR and take the scalpel? No. Am I going to, you know, open up my own practice down the street and start injecting? No. Do I coordinate all of our treatment plans with you? Yes. But I think it's it's not so much limitation as much as guidelines. Like, I practice with your philosophies in mind. So I don't really see myself as like a limited provider. I see myself more as like an extension of you. Like I'm a branch off of your tree. That's-
But it could be impossible for some personalities
yes,
to practice under somebody.
absolutely. Like, there's a lot of PAs out there that want to hold the scalpel. And so for them to work under someone to feel like they're supervised is not ideal. And I don't know if the PA track was really for them and if that's what they're dealing with every day. I don't feel limited in my autonomy. I feel like I have a lot of autonomy and I learn from you every day and I become a better provider because of it. And if I wanted more of like an independent career path, I maybe wouldn't have gone down the PA school path.
Exactly. You had absolutely all prerequisites to go into medical school.
Right. I could have applied to medical school and that it was definitely a thought that crossed my mind at one point. And then this path really spoke to me. This was what I wanted to do. I wanted to be exactly where I am right now, doing what I'm doing, and I love it.
What other major challenges you have faced at SD Medical Arts?
I wouldn't say it's challenges as much as, like I said before, it's 2.5 years of experience in wherever I get in the whatever I get in the classroom and whatever I get in clinicals, and then I'm, put out into the world. I decided to go with this like very, specific subspecialty of cosmetic surgery with you. And did I have a lot of experience in aesthetics and cosmetics? Not really. I'd done some internships on my own. I tried to get the experience and tried to, at least put a needle in my hand, but I really hadn't seen much. So I think that was a challenge in the beginning to learn and see as much as I could so I could understand, how to be an asset to your company. And that takes experience. So, do they have a cosmetic clinical rotation in school? No. Do they even have aesthetics? No. So I didn't know about lasers. I, barely knew about injectables from what I had done on my own during school. I had internships outside of school. I put in as much time as I could, but I really needed to learn from you in practice. And that was frustrating in the beginning because I'm a perfectionist. I want to be skilled and I want to be good at what I do. So to feel like I had so much to learn in the beginning was a little daunting, and frustrating because I felt like I couldn't really be as big of an asset as I wanted to be, in the beginning. But like I said, every day is a learning experience here. We see something new every single day. So I felt like I learned pretty quickly how everything works. I have to learn your preferences, obviously, whether that's medication, whether that's how you like the OR setup, how you like to, conduct consultations with patients. I had to learn all that. So that was challenging in the beginning. But in aesthetics, what the beauty is that there are so many resources to learn from. So, I feel like there wasn't any shortage of learning materials. You were always available to teach. And I feel like in that sense, I was able to pick everything up pretty quickly, but it takes time. It's not something that you learn in school, just like how you own your own business and you do like this whole other aspect of, business, marketing, and like the financial part that you weren't necessarily taught in medical school.
During your interview process, you have applied to different practices after your PA school. You have gone through multiple interviews. What was the main deciding factors with whom you want to work or don't?
Right. So I was looking at a few different things. I knew I wanted to have some aspect of surgery. And the main reason why I became a PA is so I could first assist in the OR. That was like my driving force to become a PA. So I had applied for some general surgery positions, orthopedic surgery. I looked at some like neuro ICU, like some more like floor work, and I hadn't really figured out where my place was. But when I worked with you as a student, I loved your philosophies. I loved the way that you really conducted your practice. I loved how hands-on you were with every patient and the opportunity for me to be hands-on with each patient. And, I like the everyday. You're hardworking. You want to be efficient with your time. You want to get your work done and, you know, have a good work-life balance, but also like this business is always on your mind. So when you go home, you're still working. That's kind of how I work. Whether that's a workaholic or not, I don't know, but you have a passion behind your work and then it doesn't feel like work. And that's something that I really respected and I could see myself here. As far as cosmetics, I'd always like had a passion for skincare. And at one point I thought maybe dermatology was the path I wanted to go down. I'd always cared about, my skin health and my appearance, whether I knew as much as I thought I did or not. And then I realized that dermatology wasn't really the path I wanted to go down. There's a lot of rashes and just it wasn't as like aesthetically pleasing as I thought it might be. Um, and so again, when I started working with injectables and I started having like results with patients where they would say, "Wow, I feel so much better." It was pretty rewarding. And I was like, "Wow, I like that idea of changing people's lives every day." But for someone to look in the mirror and like feel good and look good, like that takes like the reward to the next level, in my opinion.
Exactly. So it's a balance in our practice. Is a balance between high level of adrenaline
Right.
and very relaxed, luxurious type of lifestyle.
Right.
So
And I was really drawn to that. And I remember when you called me to ask me to interview, I think I like almost screamed. My voice probably hit a pitch that no one's heard before. And it was like the most exciting thing because this is literally exactly what I wanted to do is work directly for a surgeon, first assist in the OR, and like make people feel good every day. I think that, people think of cosmetics as like this superficial, you know, path that it's just so much more than that. I truly think that you make a difference in people's mental health every single day. Way more than, what people give it credit for.
why do you think cosmetic surgical field has this particular stigma?
I think people just think that it's superficial to want to, invest in money to look good. But really to me that's crazy because we all own a mirror. We all have insecurities. Whether your insecurities started at 14 or whether they started at 45, you look in the mirror and something bothers you, right? We all pinpoint on something. And if you can take care of even one little thing, it makes a huge difference. So this whole stigma behind, you know, cosmetic, plastic surgery is just breast augmentations and BBLs is just it's such a misnomer. It's truly not really what we do every day. That's so that's such a misunderstanding. But we kind of categorize it as this one big field of, superficial intervention to make yourself look better. Where it's just not the case.
I truly believe that. True. So, enhanced curvier body, is it sexy or sexist?
I think it's sexy. I think where we have sexism is where we judge that person who wants to look curvier. I think your body is very personal to you. So as an individual, you have to say what makes me feel the best and how do I feel every day looking in the mirror, whether it's do you care about how your face looks? Do you care about how your body looks? That's very personal to you. I don't think anyone else should really judge that. And I think when we do start judging it, that's sexist.
Yeah, I think if we do it for ourselves, it's sexy.
Absolutely.
But if we do it for somebody else, it's sexist.
Yeah.
If I want to enhance my curves to attract more men, that's sexist.
Right.
But if I do it for myself, it's sexy.
If you feel good and that's why you're investing in it for you, I think that's beautiful. If you're doing it for someone else, I don't know if that's the right reason.
I find, based on my experience, if my patients do it for somebody else, I have never had, or I have never seen that degree of satisfaction.
Yeah, they're never going to be happy.
Never.
Because they're waiting for someone else to look at them.
They are looking to enhance some relationship, and if it doesn't happen, they are so disappointed and destroyed. They are broken.
Right.
So whole point is, I truly believe that no matter what you do on your body, with your body, it should be more so for yourself.
Right.
You need to do it to feel good. You need to feel good.
Right.
And if you feel great, you're elated with your appearance, everything else is gonna tag along.
Right. And I think that's how you really conduct a consultation. You walk in and you introduce yourself, you meet, and then you say, what bothers you? It's not what bothers me. It's not what bothers, anyone else in the room. It's what bothers you. And how many times in your life does someone come up to you and say, hey, what bothers you? I've never really been asked that outside of our office setting. And that's such an important question to ask someone, where we all look in the mirror every single day. What bothers you?
That's right.
Because if you address something even so simple as, a freckle that you just despise, that just really bothers you every day. If you address that little blemish, what does that do for you every morning when you look in the mirror to get ready for work? That could do a lot.
Exactly.
And to me, maybe it's just a freckle, but to you, that's something that you look at and you zone in on every single day.
Absolutely. Because during my consultation, under no circumstances I'd want to impose upon anybody my opinion, which could potentially ignite a lot of insecurities,
Right.
constraints, and dissatisfaction with the whole consultation process. But who cares what I like? I need to listen to what they like. I'm here to listen to their concerns
Right.
and give my best to help them to actually unleash their constraints and insecurities and open up whole new world.
Your whole philosophy. It's really true though. And that to me is when you're opening that up for someone to tell you, they're vulnerable because, people don't like to talk about their insecurities. That's it's in our culture, it makes people uncomfortable, right? But if you do open up that space for someone like you who can help them with that insecurity, that is opening up a whole new world for someone. And that can make a world of a difference in their mental health, in their confidence level. And that correlates to every aspect of your life, not just your physical appearance. That's so superficial. What you do is so much more than that. And I come from Vermont where people don't wear makeup. People don't. It's not New York City. It's rural Vermont. Like, you know, you could wear pajamas to the grocery store and people wouldn't really look twice, right? But regardless of where you're from, people look in the mirror and they care about the way they look. Whether, a wrinkle bothers them or, you start aging and your neck starts bothering you. You start looking at certain things. It still bothers you. So when people chalk, what we do up to Botox fillers and breast augmentations, it's almost offensive because this is so much more than that. This is really changing people's lives for the better.
Exactly. So because aging process is a very brutal
It is.
entity in our life. Aging process can lead to depression.
Right.
And no matter who you are, you're from Vermont and you don't like makeup, or you're from the heart of Manhattan and you wear Gucci and Hermes product to go to a grocery store. No matter who you are, aging process is not forgiven to
No.
anybody. And to maintain or preserve your natural beauty has nothing to do with fake plastic appearance.
No.
So it's different because beauty actually starts from inside out. Quality of the skin is directly proportional to the deficiency what is inside of you.
Correct.
Microelements, vitamins, your lifestyle. So that's what we spend a lot of time educating and guiding our patients on healthy well-being.
Yeah. An optimal lifestyle.
Optimal lifestyle, optimal replenishing would actually lead to a precipitous aging process.
And that's all inside. We're not even talking about external right now. So what you really emphasize with patients is your health starts from the inside. So if you become healthier, you're going to feel better and then you're going to look better because, we can still treat the inside and the outside. But okay, say we're talking about a breast augmentation, right? For some women, like that is a huge insecurity. If someone's never had the breasts that they envisioned for themselves, if you are able to give them that, I think it goes far beyond the physical appearance of breasts. I think for them, it's more, they feel more feminine or whatever it is they're lacking, it's way more than just the implants.
We know that confidence is contagious. Boosting confidence, that's what we do at SD Medical Arts. And boosting confidence is a very challenging process.
Yeah, it is.
So it's not that easy
No.
to actually optimize you from inside out, but at the same time maintain that natural beauty. I'm not here to change anybody, but I'm here to enhance you to your visual standards. That's how you vision yourself. That's how you want to feel happier, but still being you. Laura, what do you think? Latest trend in cosmetic surgical procedure in 2025?
So I think I'm happy about where like cosmetic surgery is going because I do think that people are becoming more open to it. And they're understanding that you can have really subtle natural enhancements that don't change who you are. I think for so long there was, like we said, there was this whole stigma behind, oh, you get Botox, you get filler, you get plastic surgery, and you're fake. I do think that's kind of like we're revealing that that's not really the case. You can do subtle natural enhancements that achieve your goals for how you want to look and feel without changing who you are. I think the more natural route is becoming more popular. People aren't doing the, multiple syringes of lip filler anymore. That, the duck lip look is kind of going out. They're dissolving their fillers, they're removing the silicone. I think that it's going in a direction that's kind of where you've always been. Whereas this is really natural, subtle enhancements. You can fine tune and tweak what you want to get the result you're looking for. I think the whole fake idea and the overfilled and, the overdone look is going out and the natural look is coming in because I think people realize it's attainable.
Exactly. But in order to keep up with natural look, I think that it's fundamentally important to start thinking about aging process way earlier
Yeah.
than it actually hits that striking point. Meaning preventative medicine it works.
Yeah.
Preventative medicine is fundamentally important. If you start with microdose of botulinum toxin at age of 35 or 25, you upkeep your skin in perfect condition. You do some peel or laser treatment on a daily basis, apply sunscreen, make sure that you are going to replenish microelements and vitamins so you maintain your healthy lifestyle. Then actually it's very easy to have minor tweaks and look great at age of 75.
Yeah.
If you have not done anything and you come in at age of 65 and you want me to give you completely rejuvenated face with one syringe of filler, it's not going to happen.
No.
So preventative medicine, think about your aging process way before it's going to become critical. How does appearance of a doctor or a physician assistant or any professionals reflect on his or her performance?
So I think, especially as a surgeon, you have to be able to conduct a very intense intervention under sterility. So in a sterile environment, you have to be able to perform to prevent any complications. So as someone with their own surgical practice, if you don't hold yourself to the highest standards, whether that's the way your office is clean, the way you have your own, the way that you present yourself every day, if you didn't meet those standards every single day, I don't know if as a patient I would want to maybe embark on a surgery with you in your practice, right? If you go into an office that's, it doesn't look very clean, it maybe has an odor, I don't know if you want to be a patient there, right? You don't know you don't know where their standards are because this is what you're exposed to. I think it's very important to hold yourself to the highest standards, how you dress, how you present yourself every day, because especially in medicine, you're taking care of people's health. So if you don't give your patients the idea that you yourself take care of your own health, how are they going to trust you to take care of them? And I think that's something that you hold, very, very highly in your practice. The office is spotless. We take, we clean everything to the highest standard because we want to provide the best care for each patient. And that's a big part of it, especially in a practice where you're operating.
That's exactly how I feel. I feel like if you can take care of yourself well, you can take care of everybody else. Because to take care of yourself is actually very difficult because it's not a necessity,
No.
actually a luxury.
Yeah, it is.
Why should I wake up 1.5 hours earlier just to put myself together? I'm okay. I like myself. I do it for my patients because I respect and I'm grateful that they trust me. They come in to see me, and I want to keep up with this particular recognition.
Yeah. In this profession, every day we're presenting ourselves as providers. I feel better when I look like how I want to look. I feel better when I'm, dressed and ready for work. If I came to work rolling out of bed, I don't really know how I would perform as a provider, to be honest with you. I don't know if it would I don't know if I would be performing to my potential. So I think it is important in this field, to come to work every day looking your best, feeling your best so that you can give that to your patients.
What would be a very important message for people who potentially can get into PA school or students who are graduating from PA school? What would be your advice?
Um, I think I would have a lot of things to say, but I think the most important thing would be to make sure that this is something you're passionate about. Make sure that this is what you want to get up and do every single day. Because if you don't have a passion for this, it it's never gonna click. You're never, there's so many elements to really master in this field, and it's way more than the textbook is ever gonna show you. And you have to be able to have that motivation to do it on your own. So if you don't have the passion for it, find something else, because I don't know if you're ever going to really enjoy this and succeed in this field if you don't really want it.
Exactly. But as specifically for PAs, because you guys are going to work under somebody's license, under somebody's supervision.
Right.
What would be your advice to future PAs?
You have to find someone that you really agree with and can work well with. Like, I think with you and me, we have a very similar work ethic. We have similar beliefs. We have a similar drive for this field, and so we mesh well together. Every day I feel like I learn more about you, and in some ways I'm kind of your shadow. So I kind of follow your lead, and I'm on your schedule, but we're so similar in many ways that it's seamless. If you become a PA and you work for someone that maybe you don't mesh well with, or you have different beliefs, or you have a different work ethic, I would maybe look at a different setting. Maybe the hospital is more for you, or maybe, an outpatient practice, you know, there's different avenues to go. I mean, you can be a forensic PA and do research for, like criminal cases. There's so many different avenues you can go, but you have to make sure that you find the right one, because again, you're working under supervision. So it has to be the culture that you want and that you're going to fit into. Otherwise, it's going to be miserable.
And if you cannot work under somebody's supervision, maybe this particular path is not for you.
No. And that's something that you have to come to terms with early, because again, it's a lot of time. It's a lot of commitment. You don't want to waste that time. I truly believe that there's a medical team for every patient. And it starts with the receptionist, to the patient care coordinator, to a medical assistant taking vital. Everyone's a part of a team. And I feel like I liked the place where the PA fit in that team. If you don't necessarily want to find your place in that team, that's really what medicine's all about.
It's also collaboration, and it can make you or break you. Absolutely, you need to have healthy environment to go into every single morning.
Right.
Because we spend more than 60, 70, 80% of our time at work.
Right.
So, and it has to be peaceful and inspiring.
Absolutely. Absolutely.
Laura, thank you so much for joining us.
Thanks for having me to do what we do every day.
Laura, thank you so much for joining us. And thank you so much, our listeners, to listen to our conversations, inspiring stories, and absolutely invaluable insights. Please join us, give us a review, and we're going to be more than happy to answer all your comments, concerns, and suggestions. Please remember that your feedback is absolutely important for us. because potentially all your suggestions can go into our new topic for discussions. Until then, stay curious, stay inspired, and keep pushing forward.